Good afternoon. Welcome to Biz Talk, Believing is Seeing Talk Radio, where we walk the talk. I'm Bob Ryan.
I'm Montana Smith.
And I'm Aaron Knott, and we've got a jolly good show for you.
Jolly good.
I was going to do the accent, but I figured I'd butcher it, and people would get upset, and we'd lose both our listeners.
Because we have two Brits on today.
We do.
One
it's a Brit-heavy show.
It's a Brit-heavy show. For an Anglophile, that's very exciting. You know that.
Yeah, well, 1/3 of our team is British. So.
That's true. That gives us one Brit right there. The second Brit, Malcolm Bohm, will be on. He's president and CEO of Liquid Grids. You're going to find out how the healthcare system does its studies and how the management of those studies kind of boils down into what Liquid Grids does. You're going to find really cool ways to interact with the system, especially if you have issues. Doesn't Rush Limbaugh say issues like issues? You guys don't even know, do you?
I do.
You're too, yeah, he does.
I got it.
Okay, anyhow. I don't know why that was important. Anyhow, Malcolm will be on second half of the show. The first part of the show, I'm very, very honored to have with us one of our suits here at the company, at ESPN 1700 AM. Really cool guy. Love him very much. Mike Shepard is with us, program director. Mike, thanks for coming on board.
Hey, thanks for having us today.
Well, when you want to come on, it's obvious you're going to get to come on, and we want to honor you and really respect the fact that you're one of the suits.
Unless I'm boring, in which
Unless
case
you're
just
boring,
gonna,
yes.
Yeah, okay. I'll do my best. I make no promises.
Now, you have a very familiar voice.
Yes.
Not only are you program director here, but you're part of some of the outreach that we do with some of our sponsors, and one that you endorse highly.
Yes,
And-
La Jolla Hair MD.
Exactly. And the director of that, Dr. Richard Chaffoo, is with us, triple board certified plastic surgeon and director. Thank you so much, Doc.
Thanks for having us, Bob.
Now, if you're triple board certified in plastic surgery, does that mean you triple guarantee me I will be triple better looking?
Well, you look great now, but
I've been waiting all day for that one. I saw that you were triple board certified, and I thought, that ought to be a really good joke, but so far, no, nothing. I like that. Well, thank you for coming down.
Thanks for having me.
I want to spend a little bit of time talking about what you do at La Jolla Hair MD, but before that, why just out of curiosity, why 3 certifications? I mean, did you just not like the first one? It went on.
Maybe I stuttered or something, right? I'm not sure. So, so part of my training and background initially in interest in surgery started in head and neck surgery. And head and neck surgery, otolaryngology head and neck surgery was my first board certification. And then I decided to go on for another year training at Stanford, where I studied, hair restoration, other plastic surgery procedures in the head and neck, and then got certified in facial plastic surgery, and then decided that I hadn't been tortured enough. I wanted to go back and take another 2 years of training as a resident, training in plastic and reconstructive surgery. And so went ahead and got my certification in the American Board of Plastic Surgery. So really 3 certifications, all of which kind of added I think, dimensions and credibility to what we do in our practice.
You've been very nice to me since you met me. Most plastic surgeons, when they meet me, look at my double chin and say, I can fix that. Just a simple visit to the office, come in, we'll do it outpatient, we can get rid of that. So you've been really kind and not mentioned that to me.
I'll tell you, Bob, part of it is, we're sort of in the same age category. The other day, I was on the phone talking to one of my daughters, and I had an iPhone, which is smarter than I am. And so I was sitting there, and I pushed the button and turned around, and I said, Catherine, I'll talk to you just in a minute. There's an older guy on the line that wants to talk to you. And I realized that my lips were moving the same as that old man's lips were moving, and I realized, okay, the selfie pictures have been something that's amazing, because people will come in and say, well, look, I didn't realize I looked like that when I leaned over. Now I can really relate to that on a personal level.
I tell you what, when I look at the Facebook live stream of this, if somebody gets us from the side, it's like erase that. Exactly. Like take it off. You didn't put the skinny lens on.
Photoshop this thing?
Yeah,
right.
Yeah. Well, thank you very much. And
it's good to be here.
By the way, I'm guessing when you get invited to parties and you go to a chamber function or something, you've got to be running into the most amazing questions. What question do you get most often from people that find out you're a plastic surgeon?
So I think people want to know do we use plastic? Because of the name plastic surgery, right? You would think so. Where it actually comes from the Greek word, plaseo means to shape or to mold or to form. So I explain that. And then people will say, well, gosh, I want to look like, Brad Pitt. And I'm like, well, if there's a line to look like Brad Pitt, I want to be first in line. But so you really can't make someone look like somebody else. You can kind of improve someone's appearance to make them the best that they can be. Right. So I think it's educating people.
And the fact that you have such a broad scope of services you could offer, and yet you focus on hair is an interesting question about why hair. Was there technology in it that you saw, or was there some need that really manifested itself over others? What led you down the road to specialize in this?
So it's a great question, Bob. I think it's a combination of the fact that there's a great need for a really good hair restoration practice in San Diego. And then we were the first that actually where it was directed by a plastic surgeon. So my wife's a dermatologist, so we practiced together. We're literally the only practice where you have a board-certified dermatologist and a plastic surgeon directing a hair practice. And I think why that's important is because, as you know, there are a lot of people that are not candidates for surgery that have a medical cause for hair loss. And so my wife can see them as a medical problem, and we can treat that. And then on the flip side for me, I like the idea of hair restoration because there's a lot of men in the practice, and men traditionally are pretty easy to make happy. I'm kind of going out on a limb there, right? And also it's a permanent change, and I think you really need a good aesthetic eye to know what's going to look really good as a natural-looking hairline, not just now, but 5, 10, 15, 20 years from now.
So the artist in you is really an important part of what you're doing.
It is, and then I started to actually develop some hair loss myself. If you look at the statistics out there, 40% of men at the age of 40 will begin to lose their hair, and 50% at 50, and so on and so forth. And so one night I was playing with my two daughters. They turned sweet 16 yesterday.
Oh, are they twins?
They're twins.
Oh, wow.
And very competitive, of course, with each other for my attention. And so one night, one of my daughters had taken, I was playing with her sister on the floor, and she was a little jealous. So she picked up my iPhone, took a picture of the back of my head, and texted it to me. And I said, "Who is that?" And she said, "Dad, that's the back of your head." I'm like, "That's not that. That can't be the back. I've never seen the back of my head like that."
And who's going to hire
that
you?
Bald spot, right? Exactly. So then I didn't think. I kind of dismissed it. But then every time I got in the elevator, I was thinking to myself, why are there mirrors all the way around an elevator? Who needs to look at themselves from all these angles? Or the mirrors that you've got in the bathroom, right, that you see. Right. And so when we got our neograph...
Doc, let me stop you there. We got to go to a break. When we come back, we're going to find out more about Dr. Richard Chaffoo's traumatic experience of finding the bald spot.
Good way to describe
there we go.
That, right?
Also, Mike Shepard is with us, program director of ESPN and a few other stations here we'll get into in a second. You're listening to Biz Talk. I'm Bob Ryan.
I'm Montana Smith.
And I'm Aaron Canada.
Don't you go anywhere. A great story is yet to come. We'll be right back.
Doctor, give me the news. I got a bad case of loving you.
Doc, this is in your honor. We're listening to Doctor, Give Me the News, coming back in from break, and welcome back. You're listening to Biz Talk, Believing is Seeing Talk Radio, where we walk the talk. And today we're broadcasting from the ESET studios, ESET Internet Security. Do more. Want a podcast of this show? Of course you do. Go to ESPN1700.com. I'm Montana Smith.
I'm Aaron Canada.
I'm Bob Ryan. Were you just a little slow on the draw with that there?
Just a casual bit.
You seem a little like little.
No, I just had a lozenge, and, and I didn't want to have to have the Heimlich maneuver.
Yeah, and by the way, for those listening, when you announce what we're listening to, that's not for the listeners of the radio; it's for the Facebook.
For the our Facebook watchers, listeners.
Mike.
Yes.
Okay, we need technology help here. After the show's over, maybe.
Oh, boy.
Because we can't. How do we get the feed out to the Facebook Live? I'm not expecting you to solve it. Now, just give us money. We just need to build out the studio a little bit more advanced.
You know what? Come see me in my office after about 9 o'clock tonight. We'll take care of it, okay?
That's when you give out the money. Is
Yeah,
that 9
yeah.
o'clock?
Oh, yeah.
I walked into a Walmart years ago, and the greeter was there, and I said, "Where are you handing out the $100 bills?" He didn't miss a beat. He goes into the store, up the stairs to the left, $100 bills. I love responses like that.
Yep.
Yeah, very good. Very good. Well, back to our guest. Mike Shepard is with us. He goes by Shep here, which is pretty cool. Program director here. And also Dr. Richard Chaffoo is with us, triple board certified plastic surgeon, director of La Jolla Hair MD. Doc, thanks for coming in.
Thank you for having me, Bob.
We were hearing your story, your traumatic event, where your daughter took a picture of the back of your head and then texted it to you.
Yeah, so it was a wake-up call. And so after that, I was always looking in the mirror at multiple angles, and then I started styling my hair, trying to cover the area. So finally, we got a device called the NeoGraft, which is really, I think, game-changing technology for hair restoration. And we brought that in, and actually I ended up being one of the early guinea pigs for the device. And so I had the transplants all done to the top of my head, and I came home that night with a tiny little bandage around. I looked like one of those 60s flower children, a band around my forehead. And so I walked into the family room, and my daughter, who had taken the photograph, said, "Well, Dad, did you have some surgery today?" I said, "Well, yeah, I remember I fixed that spot on the back of my head. You know, the one that you took that selfie on?" She's like, oh, I'm really sorry, Dad. You looked fine beforehand. So I was able to do a reverse guilt.
Yeah, there you go.
Kids
She's
can
never
make
going to criticize you again.
Exactly, that was it.
Well, that's how you control the children, guilt.
Exactly. So, but it was really life-changing because honestly, when the grafts grew in at about a year, I mean, it made a huge difference in that area in my scalp and really, I think, improved my own self-confidence. So I like to share that story with potential patients because they understand that it's something that, bothers a lot of guys and some women.
Boggles my mind is here you are, a physician, triple board certified, very successful in your career, good looking, got a family, married to another doctor, and yet your confidence was shaken.
It was.
By the loss of a few hair follicles.
Exactly. And so it's amazing.
That is interesting.
It is interesting. And so how we perceive ourselves to some extent determines how we interact and interface with the world, what our level of self-confidence is. So I could definitely, I really hadn't focused on it that much because obviously it wasn't an area that I could see, but once it was brought to my attention by my daughter, then I almost got fixated on it, and then after having it done and it's fixed now, I just don't think about it anymore. So it's something that I like to tell that story to prospective patients because I understand where they're coming from and what their journey is, and I think it takes a lot for a guy. We see some women with hair loss, but mostly men, of course.
So your next certification is going to be in psychiatry.
Maybe so.
Is this procedure intended to be a one and done, or is there the possibility that it?
So that's a great question. It depends on the extent of the loss, whether it's a stable loss, whether it's progressive, how old the person is. So really, the hair restoration procedure is tailor-made, if you can pardon the pun, for the area or areas that need to get involved. So if it's a smaller area, oftentimes, as you say, it's a one and done sort of process. If it's something where you've had a more extensive loss, and it may involve more than one procedure.
So, Doc, you mentioned a device that you brought
Yes.
home. What was that device called?
So the device is called NeoGraft.
NeoGraft.
And it's a device that actually was developed in France about 10 years ago and then brought over to the United States. We were one of the earliest adopters here in San Diego. And just to give the listeners an idea, hair restoration started probably back in the 60s, and it was a procedure where we would take hair from the back of the scalp as a strip with a scalpel and a cautery. We would take that out, and then we would close the scalp
Excuse me,
up.
Shep, you're wincing a bit.
Right. Exactly.
When I was looking at hair loss solutions, I looked at that and I just said, no, it's not worth it. I want a new head of hair, but I just can't do the strip method.
Right, exactly, and that.
It does make you wince a little.
It
bit.
does,
yeah.
and so, but that's all we had, and of course, and that's called the FUT, follicular unit transplantation, or strip procedure, and it's been the standard type of treatment for hair restoration surgery since back in the 60s, and it really hasn't changed or progressed or become any more sophisticated. And it did yield a large number of grafts for areas, but the problem was, Bob, that it was a more invasive procedure.
Yeah.
So what that meant was that you would have sutures or staples, you'd have a lot of swelling, pain. Some people would have numbness lasting literally months after a procedure was done.
And then what about the pattern on the hair? Was that noticeable with
so
a
you
large...
could oftentimes, you would end up with a scar that was noticeable. The hair would thin around it, and it would look almost like you'd had a brain operation.
Oh.
So you have to wear your hair longer and cover it. But again, that's all we had till about 7 or 8 years ago. Now with NeoGraft, the difference is that there's no longer a linear scar at all. The procedure involves a tiny punch under a millimeter where we go in and individually extract the follicles, and the scalp closes or collapses in the surrounding areas. And so you literally have no long scar. You don't really get thinning in the donor area. Because it's a more superficial procedure, you don't get the numbness or the
So are you
postoperative pain.
transplanting one follicle at a time?
Absolutely. Just the way they grow
Seriously?
the same way that they grow in your scalp is the way that we harvest them and also transplant them.
I'm reminded of like cross stitch, where you're doing just one little thing at a time.
How
right?
many follicles do you typically take?
So it depends. I mean, if it's a smaller area, it might be just 1,000 follicles. It could be up to 3,000 follicles if we're transplanting a larger area.
And you do that?
I do that along with I have actually there's 2 staff on my team, both of whom one of whom is a registered nurse, and she's been doing hair restoration for a long time. Another medical assistant that works with me that's actually certified in hair restoration. So we have a team because it's a team approach. Obviously, there's a lot of
Well, you're
hands-on.
having to harvest each follicle,
each individual follicle,
and then replant that.
and then replant that.
And you're doing well. We'll get back to that in just a second. Great conversation. Dr. Richard Chaffoo is with us, triple board certified plastic surgeon, director of La Jolla Hair MD, along with Mike Shepard, program director here at ESPN 1700 AM and some other stations, which we haven't talked about. You're listening to Biz Talk. I'm Bob Ryan.
I'm Montana Smith.
And I'm Aaron Canada.
Don't you go anywhere. We're going to be right back, folks.
Why should I care if I have to cut my hair? I got to move with the fashion or be outcast.
Welcome back. You're listening to Biz Talk, Believing is Seeing Talk Radio, where we walk the talk. And you're listening to us on ESPN 1700. But did you know you could watch us too? Yes, you can. Watch us on Facebook. Visit our Biz Talk Radio page. Share your comments. And of course, we always appreciate your likes. I'm Montana Smith.
I'm Aaron Canada.
And I'm Bob Ryan. Glad to have you with us today. We're talking with Dr. Richard Chaffoo. He is triple board certified plastic surgeon, director of La Jolla Hair MD, and also one of his patients, and our program director here. Mike Shepard is with us, and we're glad to have you both in. Thank you so much.
Thank you.
Doc, you were talking about the process of the procedure.
Sure.
If we could move on with that a little bit, I'd like to get that, and then maybe get Shep's input on what's happened with
Of course. So, Bob, it's really, the bottom line is this game-changing technology. And I compare NeoGraft to what's happened in other fields in surgery. For example, in general surgery, it used to be if you took a gallbladder out, you had to make a huge incision. Now we're down to literally making small openings.
Kind of orthoscopic.
Exactly.
type
So it's a
surgeries,
much shorter procedure, much easier. The same thing with orthopedic surgery. So now in the plastic surgery and hair restoration areas, the same thing. So we're actually able to get as good, if not a better outcome I think a better outcome for a patient using a NeoGraft than the strip technique, and we're not having all the downsides of that long scar and the thinning out of that donor area and changing your hairstyles. Because, of course, a lot of guys are wearing their hair quite short in the back today. Will come in, or we see a lot of military people being in San Diego. They just don't want to have long hair. They don't want that strip technique done.
Yeah. Now, just out of curiosity, before we get to Shep, the process seems like if you're doing that one follicle at a time, that the time it takes you to do this has to be much greater than if you were just doing the older method. How does that reflect in the cost to the patient? Is there a much larger cost with this?
There really isn't a significant difference in cost, which is interesting. The actual time that's taken for the procedure, if you compare a strip procedure from start to finish with, say, a knee graft procedure from start to finish, the time is actually quite similar. In terms of the harvest will take longer, but remember that when they harvest that scalp from the back, then you have to take that and divide it multiple times to graft. So you're actually traumatized.
So you're not saving that much time doing it the
You're
old
really
way.
not.
Okay.
No, you're actually not.
All right. Now, Shep, you're a patient.
Yes.
And just out of curiosity, not many guys that have their hair done and fixed like this really want to announce it to the world. And here you are telling the whole world that you've had this procedure done. Is that an odd thing for you personally?
Not really, because first of all, I had to announce it because I've been bald for years. I mean, the top of my head for years there was nothing there. And I started thinning in my late 20s and just progressed. And I'd looked at all these other, procedures. I, looked at everything. I looked at the wigs, the bad tubes, all those things, lotions, creams, I tried it all.
It was an important part of your life.
Yeah, I just, if I had a choice, I wouldn't be bald. I think most guys are that way. If you give them a choice, some guys do, some guys just, and that's fine. But I would say the majority of people or guys who are bald would prefer not to be.
It's the guys that look good bald that pull it off.
Yes, exactly.
The Yul Brenners of the world,
exactly.
Right?
And there are guys like that, then God bless them. I'm not one of them.
Yeah.
So, and it wasn't really for other people. It was for me. I just, it comes back to confidence, comes back to how you feel about yourself. And I had looked at a lot of different things. I'd looked at the old strip method. And when they walked me through the procedure, I just said, my vanity comes to a point, and I thought, no, I don't want to do that. And then I heard about knee graft and was really intrigued. A little skeptical because I'd looked at everything else, through the years. But I went in, I had my consultation, which was great because nobody's trying to sell me anything. I mean, it was like, well, we got to make sure you're a good candidate too. Let's talk this thing through, figure out what you want, how we can do it. And we talked it through, and I thought about it, and I read a little bit about knee graft, and was very impressed. Had the procedure done in a few hours on I think a Thursday or Friday, and if you look at the pictures at me, I don't know if you've seen the one.
No, I haven't.
There's one of me in the dugout of Padres about 3 years ago with the BCA staff here, and if you go look at that picture. Our good friend Joe Totino is about 100 pounds lighter, and I don't think it's 100 pounds of hair, but it's significantly more hair than I had. And in fact, people are amazed. People haven't seen me for a while.
Well, I just met you probably 9 months ago for the first time.
It was
I had no idea that you didn't have hair a few years ago.
Yeah, as I tell Darren on the Mighty 1090, there was nothing going on up there. And I mean it in a couple of ways.
Two things. Number one, if you ever get tired of your voice, I want it, because I love your radio voice. Every time I hear the commercial with you on it, I sit there and get jealous of your voice. The second thing is, I think people that hear product endorsement type commercials often wonder if that person really honestly uses that product or they're doing it just for the money.
Yeah, it happens all the time. I go out to Mighty 1090 events, and they'll come up to me and go, hey, that works. As if I've been sitting there making up, some incredible story about it. And in fact, I mean, it's very transparent. You can see me before and after on the website. It's there, and I couldn't be happier.
What's the recovery like? Are we staying out of the sun, out of the ocean, or?
Early on, you do, but I mean, my recovery, I liken it to it, go and get my teeth cleaned. I mean, that's kind of the procedure it was. And, I was back at work the very next day, didn't have any big swelling, didn't have any problems. And so I'm very grateful to Dr. Chaffoo.
Doctor, the business that you're in, medicine to begin with, is an incredibly interesting world to live in, number one. But and rewarding, I'm guessing, to a lot of physicians, but you have a kind of a unique reward in that you're not just helping people with their physical, you're helping them with their appearance.
You really are, Bob, and
that's a huge part of our world.
It's a huge part, and my own small journey for my own hair restoration and how it changed how I felt about myself. There's no question that when We have, men that come in that have lost the hair, and you can restore the hairline to where it's completely natural. And I think, Bob, one of the things that people worry about is, we've all seen hair that didn't look good. The cornrow, the doll's hair look, all that kind of a look. You'd rather not have hair than look like that.
Yep.
So today, literally, the way that we do hair restoration surgery is we're transplanting each individual follicle back in the scalp the way God created it. And so when your hair is wet, when you come out of the shower, you come out of the pool, the hot tub, and slick it back, nobody can tell. And it's permanent. It's there for you permanently. Your hair will grow like that the rest of your life.
So even when somebody runs their hands through your hair, they won't be able to tell.
No, they don't pull it off. They don't pull it out.
I'll have to try it after the show.
Maybe we'll do that later.
When I come for the check, right?
Yeah, exactly.
Mike Shepard, Program Director. Shep, thanks so much.
Thank you very much.
Dr. Richard Chaffoo, thank you so much. Triple
Thank you,
board
Bob.
certified La Jolla Hair MD, and you can check them out at lajollahairmd.com. Appreciate you being here. You've been listening. I keep saying you've been listening. You are listening to Biz Talk, Believing is Seeing Talk Radio. I'm Bob Ryan.
I'm Montana Smith.
And I'm Aaron Canada.
Up next, Liquid Grids. Stay with us.